Owen Thompson.
Thank you, Madam Deputy Speaker. And can I begin by extending our continued thanks and gratitude to all those working around the clock to help keep all of us safe and to look after us and those who are certainly most vulnerable in our communities. I'd also like to extend a thanks to the millions of people who have already acted on the Government's advice to stay at home. I don't think the importance of this can be stressed nearly enough, because this is what we all need to do to protect our friends, families and those vulnerable people in our communities. It is deeply unfortunate that some employers, such as Sports Direct, seem to be acting in an entirely irresponsible manner, and I do welcome the comments that the Secretary of State has made in relation to that. And looking to see what more we can do, can the Secretary of State outline when he expects that we'll be in a position that all frontline NHS staff will have the PPE that they need? We need to be supporting these people as much as we possibly can and doing everything we can, given the extent that they're putting themselves, the risks that they're putting themselves in front of. How many additional ventilators have we managed to procure since the Prime Minister put out the call to manufacturers? And I can ask if the Government are planning to accept the EU offer to sharing central procurement of ventilators, testing kits and PPE. Madam Deputy Speaker, Scotland's got a number of qualified doctors and nurses who arrived in the country during the refugee crisis. Can I ask if you'll commit to talking to the Home Secretary to see if there's what possible actions could be taken to relax existing rules to allow these people who are qualified medical professionals to support the country that they've adopted as their home? And can I also ask, is he ensuring that the rapid and effective contact testing, in light of the outcome of the Keeling study published by his own government on the 20th of March, showing such action could reduce the number of people infected by each case from 3.11 to 0.21, which would be a significant step towards further and greater containment of this current outbreak? And finally, Madam Deputy Speaker, can I just stress to the Secretary of State to I suppose to press the urgency with other Cabinet members of finding that support for particularly those self-employed who are still waiting to find out what position they're going to find themselves in, because we know that the pressures that people become under when they don't have any financial backing and the potential impact that that could have on their health, which would put further pressure on the system.
Secretary of State.
Well, thank you, Madam Deputy Speaker. On the last point, of course, there was an urgent question on exactly this issue, and it really is a matter for the Treasury. On contact tracing, he's right that it is incredibly important, and one of the reasons that we've managed to be behind other European countries in the curve is because of the amount of contact tracing that we did. But at this stage in the virus, being able, and the epidemic, being able to have contact tracing of everybody in the way that you do when there's a very small number is not possible. But we are looking at how we can do that better with individuals being able to contact trace, including using technology. He asked about refugees. I don't know if he was in the chamber yesterday, but that was brought up, and I said then that I'll look into it and I'll get back as soon as I can. He asked about the number of ventilators. We started with around 5,000. We now have over 12,000 that we've bought, and we've also had the call to arms for manufacturing capability to be turned over to ventilators, and that's been very successful. And can I finally say I strongly endorse and support the Scottish Government and the SNP's backing and the UK-wide approach to get the message out, first and foremost, to everybody, that the most important thing anybody can do is to stay at home.
David Davis.